Carl Jung thought that everyone should have psychotherapy because no one should be dragged along by the unconscious, which was in violent opposition to Freud's perspective that it is a highly specialized medical intervention, specifically with a focus problem. Today, and the reason why we have this training is basically because everyone should have an assessment. Every patient potentially could benefit from a psychodynamic assessment and a psychodynamic formulation because it helps with understanding the patient. It helps with clarifying what you're going to be doing with the patient. And it also helps to identify the gaps, which is where the possibility of the unconscious is in place. When Malin was Malin in the 1970s did excellent work in this area, which with a focus particularly on brief dynamic interventions. And he found that from an audit of the large amounts of psychotherapy that were being run in his institute, that there were a number of factors that predicted whether there would be a good outcome. One of them was the need for psychological mindedness in terms of whether or not the person had a mindset that their behaviors and difficulties were related to issues of the mind. There needed to be at least one meaningful relationship. The patient needs to be able to connect with at least one other person. If they can't connect to anyone, they can't forge an attachment and therefore won't respond well to therapy. There needed to be a lack of risk factors, such as things like recurrent suicidality, substance abuse issues. They needed to be strongly motivated. It was useful to have a circumscribed problem in terms of being able to describe what the actual symptom is, whether so something which you can describe in one line, such as recurrent suicidal ideation of 3-year onset. It was also good if there could be an evidence of achievement, not necessarily with the psychodynamic therapy, but if they showed some benefit with, say, CBT or another kind of psychotherapy, that was also a positive sign. So these were things that were associated with the likelihood of an improved outcome for the patients. But the challenge is that the patients who need the psychotherapy most are the ones who are most likely to fail because they're more pathological. And the more unwell you are, the more likely it is that you're going to need the psychodynamic intervention. And that is that's one of the really difficult things. So it's midway between what Jung and Freud were thinking. If what you're looking for is a straightforward, easy patient, fine, obsessive compulsive personality disorder. If what you're looking for is to try to be able to provide something that will help people, then my answer is everyone should have a psychodynamic assessment. And then through the process of that, you can do a management formulation to work out the pros and cons of a psychodynamic intervention. So I do think everyone should have an assessment, and no, I don't think everyone should have psychodynamic therapy.